We have a Constitution. So until someone changes the Constitution, we live by it. They don't have the right to do this. They absolutely don't have the right to do this. I would like to know how, as a United States citizen with the Constitution, I have certain unalienable rights. And he can't have those. And neither can the state, and neither can the federal government. So when they decide when I should die or what quality of life I can have, that's out of their jurisdiction.
Who get very sick, and raise your hand if you've ever been to a fundraiser for a family because they can't afford to pay the health care bills. Go ahead, raise your hands. I thought there were more compassionate people in this room, but that's fine, raise your hand. But the fact of the matter is, we all know somebody. We all know somebody who's been in that situation. I'm serious. You know, if you have a kid or you have a spouse and they get really sick, God forbid, you know, oftentimes your insurance will run out well before the bills are covered. And then you've got to pay for it. And that's a challenge for any family. And I don't think any of us should have to go bankrupt because our kids get sick. And I think most people would agree with that. We have another challenge that traditionally in the United States, much of the health care is gained through employment. You get it through your employer. That's the traditional system in the United States. And that's okay if you work for a big business, because most major corporations are either self-insured or they have pretty decent plans. But it's the small businesses that are challenged to provide health care for their employees. Right now in the state of Ohio, about 50% of small businesses provide health care for their employees. Those that don't, the employees have to go out on the market and try to find private health care. I don't know if you've tried to do that as an individual, but it is a very, very difficult thing to do because the whole concept of insurance is to gain and to become part of a larger pool. And if you're not part of a larger pool, your premiums, you know, are considerably higher. And so it's difficult for a family that's not getting coverage through their employer to get affordable access to quality health care. That's a challenge. So we have these challenges. We also have the challenge. That's a challenge. So we have these challenges. We also have the challenge in that we have the most expensive healthcare system in the world. Now, we've got the best medical system in the world if you can afford to pay for it. But if you can't afford to pay for it, it's a problem. And there are reasons that the costs continue to increase within our system. So, in the legislation that's being proposed, and like I mentioned, there are 3 different versions now in the House, but much of what is trying to be done is trying to contain those costs, trying to dramatically reduce those costs, to provide coverage to every American, to ensure that if you are covered, you can't be kicked off because you get sick, and to make sure that if you have a pre-existing condition, you can still be covered. That's what we're trying to achieve. The question is there enough savings in the system to pay for it? And if you're going to pay for it outside of that, how does that happen? So, there are a couple models, and I would encourage you to look at a few models. The Cleveland Clinic, for one, and the Mayo Clinic, for another. We have a challenge in the United States in that we have a fee-for-service model for reimbursement. Now, on the surface, that makes sense. That if a doctor or a hospital provides coverage for a service, they should be reimbursed for that. That makes a lot of sense. However, if that's the way a hospital or a clinic or a physician is incentivized through profit, we will see overusage of services. And that happens. We know that happens. So the question is how do you get your arms around the quality of care? So rather than addressing you when you get sick and say, I'm going to cover your care when you get sick. So rather than addressing you when you get sick and say, I'm going to cover your care when you get sick, how do we incentivize physicians? How do we incentivize systems to keep a person well? and to provide incentives for both the patient and the physician to encourage wellness, so that we do, in fact, try to prevent diseases which are, in many cases, preventable. And we're talking about things like diabetes and hypertension. And we work with those patients to get checked up regularly, to stay healthy, to have healthy diets, to stay in shape. And we incentivize that. Now, currently our system doesn't incentivize that. But we will pay for the diabetes coverage. And we will pay for the diabetes coverage. The system itself doesn't incentivize it. Now, there are certain payers that do, and I will grant you that. But I have spent the last several months talking to many, many businesses about their health care plans. And it depends. It depends who you talk to. In some cases, they have plans locally to incentivize health and wellness, and their premiums have been reduced. In other cases, they have tried to do that, but they don't see a reduction in premiums because the insurance company isn't willing to work with them in reducing those premiums. What we're seeing on average, and I'd love to talk to anybody that's a small business owner in here, but I've talked to a lot, is that we've seen double-digit increases in the cost of premiums almost every year in healthcare. Now that's an exorbitant inflationary rate that we simply can't keep up with. There are additional problems in our system. I don't know how many of you are on Medicare. Raise your hand if you're on Medicare. You're familiar then with the donut hole. The donut hole, for those of you that are not familiar, is around prescription drugs. And what happens is that Medicare will cover you and cover your prescription drugs up to a point. And then your benefits run out. I was just at my pharmacist with my daughter about an hour and a half ago. And we were talking about the donut hole. And he was saying, yeah, I've had situations where 1 week I'm charging somebody $15 for a prescription. And then the next month, when they get that exact same prescription, I've got to charge them over $1,000. And they come back to me and say, well, what is this? It's the same prescription. It's just the next month. Why has it gone from $15 to $1,000? And that's the donut hole. And that's because we cover prescription drugs up to a point, and then coverage will pick up again if it's catastrophic, if it reaches a catastrophic state. We need to close that donut hole. Now, I also, and the way we're going to close that donut hole is by working with pharmaceutical companies to negotiate the pricing and bring down the cost of a lot of those drugs. So, now let me talk a bit about. There's been a lot of talk about the public option. So I want to explain. Listen, I'm taking 10 minutes to give an overview of what's going on in Congress.
Hey guys, let them speak. If you're with me, let them speak.
Thank you. Thank you. What I want to talk a minute about the public option, explain what the public option is. Right now, the way the bill is structured, if you're on an existing plan, you can keep that plan.